Almost 1/4 of the world's population has been infected with tuberculosis bacteria, yet most people don't even know it. How is that possible? And when does TB actually become dangerous? Let's break it down. What is tuberculosis? Tuberculosis, or TB, is an infectious disease caused by Mycobacterium tuberculosis. It primarily affects the lungs, but it can spread to nearly any organ, including the brain, kidneys, spine, and lymph nodes. Globally, TB remains one of the leading causes of death from a single infectious agent, despite being preventable and treatable. Latent versus active TB. Here's a critical distinction. After exposure, 90 to 95% of infected people never develop symptoms. This is called latent TB infection. The immune system contains the bacteria, preventing it from multiplying or spreading. However, the bacteria are not always eliminated. If the immune system weakens later in life due to conditions like HIV/AIDS, malnutrition, diabetes, aging, or immunosuppressive therapy, TB can reactivate and cause active disease. Active TB is dangerous, symptomatic, and contagious. Why TB is hard to kill? TB bacteria have unique features that help them survive. They are slow-growing, oxygen-dependent organisms with a thick, lipid-rich cell wall containing mycolic acids. This structure makes TB resistant to drying and weak disinfectants, difficult for immune cells to destroy, and detectable with acid-fast staining, a key diagnostic feature. These properties explain why TB requires long treatment courses with multiple drugs. How TB spreads. TB is transmitted through the air. When someone with active pulmonary TB coughs, sneezes, or speaks, microscopic droplets can be inhaled by others. Most inhaled bacteria are cleared by airway defenses. TB, however, can reach the deep lung air sacs, where immune cells called macrophages engulf it. Instead of being destroyed, TB can survive inside these cells, multiply, and establish infection. Primary infection and immune response. Within a few weeks of infection, the immune system responds by forming a granuloma, a structured attempt to isolate the bacteria. The center of this area undergoes caseous necrosis, meaning the tissue dies and becomes soft and white. This initial lung lesion is known as a gone focus. When nearby lymph nodes are involved, the combination is called a gone complex. Over time, these areas may heal with scarring and calcification, sometimes visible on chest X-ray. Reactivation and dissemination. If immunity declines, dormant TB can reactivate, most often in the upper lobes of the lungs, where oxygen levels are higher. Reactivated TB may form cavities in lung tissue, causing bacteria to spread, through airways, causing further lung damage, through blood or lymphatic systems, leading to miliary TB. Disseminated TB can affect multiple organs, causing complications such as TB meningitis, spinal TB, Pott's disease, kidney involvement, adrenal insufficiency, cervical lymph node TB, known as scrofula. How TB is diagnosed. Diagnosis begins with screening tests: tuberculin skin test, Montu test, interferon gamma release assays, IGRAs. These tests indicate prior exposure, not active disease. If screening is positive, a chest X-ray is used to assess lung involvement. In symptomatic patients, such as those with chronic cough, fever, night sweats, weight loss, or coughing up blood, sputum samples are analyzed using microscopy, culture, and molecular testing. Treatment and drug resistance. Latent TB is treated to prevent future activation, often with a single antibiotic taken for several months. Active TB requires a combination of antibiotics for an extended duration to fully eradicate the bacteria and prevent resistance. Patients are often managed using directly observed therapy, ensuring medications are taken correctly. Drug-resistant TB is a growing global concern. MDR TB resists first-line drugs. XDR TB resists even more advanced treatments. Newer medication combinations have significantly improved outcomes, even in highly resistant cases. Key takeaway: tuberculosis is common, complex, and persistent, but it is detectable, treatable, and preventable when managed correctly. Understanding the difference between latent and active TB, recognizing symptoms early, and completing treatment saves lives and stops transmission. If this explanation helped you, like the video, share it, and subscribe for more clear, evidence-based medical content.